My diagnosis was 5 years ago, July. And when I was first diagnosed, I remember the Olympics were on, Summer Olympics, and I honestly, doing the research we'd done and you know what they say about expected life expectancy and stuff, I didn't think I'd be here for the 2016 Summer Olympics, but I was. And I plan to be here for many more Olympics. You've got to be proactive in what you do. You can't, if you have any symptoms, which I haven't to date, but I did have sciatic pain. And maybe I'd been to doctors, but maybe if I'd pushed it even more, I would have found out sooner. And maybe it wouldn't have been as progressed as it was when I found out. I think you need to find a doctor who is in your specialty. I mean, there's many great doctors out there, but it's best if you can have someone who knows exactly the best way to treat you. I think you should get more than one opinion. In my experience, because I moved, I saw 2 different doctors. I had my doctor in Texas and then my doctor here. Had I stayed in Texas, I would have gone to see someone else after getting treatment established, because you want to make sure you get on that right away. I personally think a diet is a big deal. I think the first thing you've got to do is cut sugar out. That feeds the cancer, and it's just horrible. There are many options out there. There's stevia, there's xylitol if you need your, so you've got honey, you've got maple syrup. Eat an angiogenic type of foods as much as you can. I mean, there's no medical basis for this, but I've been eating that way for over 5 years, and I'm as healthy as I can be. And, you know, do as much research as you can. Not everything out there is true. And if you have any questions, ask your doctor. My doctor will tell me the truth, whether what I've read is, you know, not that accurate, whether it's not great for an EGFR mutation, because there are different treatments for just regular, more lung cancer and mutant gene lung cancers. And you've just got to keep a positive approach. It's great to have a great support system. I don't like to talk about my diagnosis very much. It's not something we talk about every day. I don't tell, you know, just anybody on the street. I've been very selective. But my husband is my rock. My kids, they're always looking out for me. I go to the store, they're looking up stuff. Can Mommy have this? Oh, no, she can't. It's got sugar in it. Oh, it's got wheat in it. It's got milk in it. She can't have that. Oh, Mommy, you can have this. And they get all excited and bring it up to me. I talk to my husband. We don't talk a lot about it. A lot of it's just silent. And scan days are he comes with me to all those appointments. They're very stressful. But having him there, and when it's all done, you know, we do our cheers if I'm stable or no progression. And if there's little progression, we still think positive. And I don't know exactly who my family all talks to. I think my parents and my siblings may talk amongst each other. We don't talk about it a lot together. My second oldest child has had some trouble with dealing with all this, but he's gotten better over time. I think them seeing me look healthy helps. Our younger 2, I don't think, know too much about what's going on, and all in good time. I don't think they need to know details right now. But everybody needs a support system, whether it's you yourself or your family or friends.